We'll just dive right into what's been a a really crazy year, honestly. It seems like it hasn't stopped. It's just one thing after another. And honestly, I had been thinking about wanting to do a story kind of like this, just in terms of the coronavirus. And then we know over the last 2 weeks now and still going forward, we're seeing lots of protests and really heavy topics discussed in the news. And so I guess, first of all, what can this do to a person, a person's psyche? How does it build up anxiety to kind of ingest this kind of information day after day after day?
Yeah, right. So I think many of us are really emotionally overloaded right now. Perhaps already fatigued by social distancing, anxious about what it means for businesses to open back up, saddened by losses in the community already related to the coronavirus. And now, on top of that, perhaps feeling anger or guilty about what has happened to George Floyd, Breonna Taylor, and countless others. And so these feelings can be really uncomfortable. And so I think it's first important to remember that emotions are normal human responses to stressors, right? We're designed to have emotions to communicate what's important to us, what matters, and to motivate us to make changes. So I think a first step in kind of coping with all of this is to acknowledge that what people are feeling makes a lot of sense, and for people to not be hard on themselves for having these emotional responses, right? These are hardwired into us.
Mhm. And so, I mean, some people, I mean, I personally, I just on a daily basis battle anxiety, depression, but do you think people who don't normally have an experience dealing with those types of added stressors in their lives may be feeling that now and aren't used to having reactions in that way, of feeling anxious, of feeling, particularly down? Can this kind of extend itself into others who've not really dealt with any type of mental health issues before?
Yeah, I definitely think so, right? And so I think it's important to again remember that anxiety and sadness, right? They're normal human emotions. And so we're all meant to feel them to different degrees depending on what's going on in the environment. And so when things are really seemingly out of control, right? And so in times of really great uncertainty, that's a time that it makes a lot of sense for people to feel anxious, right? And so folks that may have struggled with anxiety in kind of an interfering way in the past are probably hit the hardest. But it would not surprise me at all that that many people, right, that maybe have not struggled with anxiety in the past are really feeling some of this, because when you don't know what's going to happen, right? Like, are we back to work? Are we not back to work? Are there going to be systematic changes in the way that sort of policing is handled in this country? What's going on with leadership, right? A lot of that, I think, makes it really difficult for folks kind of also stuck at home to get a handle or to get some control in the situation. And so that it makes sense that you'd feel anxious. That's what anxiety is for, to kind of tell you, hey, pay attention to this. It's kind of a big deal.
So beyond acknowledging the fact that it's normal to feel this way and kind of expect it, maybe if we're going through something like this, do you have other advice in terms of coping, especially when a lot of us still are at home and, kind of our normal, resources may look different right now? Do you have other advice for folks right now?
Yeah, absolutely. So I think if people are feeling particularly overwhelmed, there's two sort of science-based coping strategies that I often suggest as kind of the first line thing to do. So first and foremost, it's important to like examine how you're thinking about current events, how you're thinking about coronavirus, right? Like in terms of coronavirus, are you telling yourself that you'll definitely get sick if you go back to work? Are you telling yourself that you can't handle one more day without childcare? Are you telling yourself that there'll be another spike in the fall and we'll all have to shut back down again? The way that we think about the stressors in our lives can make a difference with regard to the intensity of the emotions that we feel, right? So could there be a more balanced way to think about the situation? So, instead of I'm definitely going to get sick, maybe, well, the probability of getting sick is not zero, but I can take necessary precautions like wearing a mask, using hand sanitizer, and that might prevent me from getting sick, right? It's a little bit more balanced. With regard to racial injustice, perhaps people are noticing thoughts like, I should have been doing more to speak out against racism, already. And that might lead to feelings of guilt, right? Some feelings of overwhelm. And so instead of stopping there, it might be useful to acknowledge, yeah, like maybe you could have done more previously, but there's still plenty of work to do. And you can get involved going forward, right? And so in both of these examples, I'd encourage people to sort of shift their perspective, reminding themselves that they do actually have a little bit more control, even in what feels like an overwhelming situation.
Gotcha. So kind of pointing to the actual reality of the situation rather than what you're coming up with in your head, which I know lots of us are very good at coming up with, things that aren't necessarily true. And then would you say, like along with the masks, you're talking about concrete steps you can take, pointing to things like that, wear a mask, wash your hands, maybe avoid large gatherings if those start to happen more and more. And then with the racial injustice, maybe looking into ways that you can actually help make change in the way that you're comfortable. If it's donating, protesting, what have you, reading, all those types of things.
Right, absolutely. And that kind of brings me to sort of my second kind of coping strategy. And that has to do with what you're doing, your behaviors, right? So it's important to remember that emotions are messages about the world around us, and they're meant to prompt meaningful action. So what are you doing with these feelings? And I think for a lot of us, a common behavioral response is consuming information. And often what that looks like is social media scrolling. I'm definitely guilty of that myself, right? It sort of gives the illusion of staying involved, informed, kind of gives you that illusion of control, but it actually doesn't make us feel better in the long term, right? Like it might give us this sort of like sense of purpose. Like I'm reading this thing, I'm doing this, I'm staying involved. I have to know everything that's going on. But you're not actually taking like a real action. So again, for coronavirus, perhaps it is kind of reading an article about sort of the probability of getting sick in certain environments, and then potentially sort of challenging yourself to maybe go do something outside, right? Trying to sort of show yourself through your behavior that that the realistic risk of getting sick is different in different situations, right? And then with regard to some of the racial injustice, right? Like I think for a lot of people, when you feel guilty about, perhaps not having done enough, or oh my gosh, like I can't believe this is happening, sort of some of those thoughts, it can feel really overwhelming, right? To examine what's making you feel guilty and to think about making those changes, right? But those feelings probably won't go away. You can kind of pass them along by sort of scrolling or reading, or trying to have things go back to normal as soon as possible. But the way to really address emotions, right, because they are these meaningful sort of communicators about the world around us, is to take action, right? So what can you do? And so that's going to be different depending on each individual. But I think thinking about what are these actionable steps that I can take.
Yeah, and I know even especially coupled with my job, it's my job to be informed, to stay on top of everything. And so I know, and I kind of, to speak to what you're talking about, a lot of people, yes, they want to be on their phone so they feel like they are in tune with what's happening and plugged in. But I mean, that really does have a negative side effect when it's kind of like too much of anything is bad. And so that's what I've actually deleted all social media off my phone in the past several weeks, because it was like, I can't take this much in all the time.
Yeah.
And so how do you explain, or how would you suggest maybe that someone stay on top of what's going on and they don't, disengage completely from the news and the world and these important events that are going on, but also still, care for themselves and look after their own mental health?
Yeah, absolutely. So often with my patients, I'll prescribe like worry time, and so you could sort of set up a time when you watch the news, right? So maybe it is kind of watching sort of the nightly news, or watching in the morning, right? Getting your dose, you're setting a time limit for the amount of time that you're on social media, given that, there are some good things that come from social media. These platforms do keep us connected in a time when we aren't really able to socialize. And so we wouldn't necessarily want to sort of cut that off, but right, setting some boundaries around when we are, connecting to social media. And for many of us, it becomes so habitual, right? So like last night, my husband and I, like we put our phones in a drawer, which is really the first time we've ever done that, because even just like setting it down, it's just so habitual to pick it back up. And so setting those boundaries, right? reminding yourself that if you do want to take a break, it doesn't make you a bad person, right? And reminding yourself that by kind of taking a break from some of this onslaught of really negative news can actually sort of buoy you, right? Like relieve some of that fatigue so that you are able to take some of those meaningful, actionable steps, right? Like I know in myself that after sort of scrolling, I'm pretty tired at the end of the day. And that makes it a lot harder for me to be like, okay, let me think critically about which organization I'm going to donate to, right? And so taking those breaks can actually help you to make lasting change, sort of in the long term.
Yeah, for sure. No, that's great advice. And yeah, it makes sense. You need to rest to be able to keep going. It's just like any type of activity in life. You kind of have to take a break for a little bit. And obviously there's varying degrees of how people are feeling. And if someone is feeling particularly, they really think like, hey, this is more than I just need to set my phone down. Like, I think I'm really struggling. What does that person do?
Yeah. So if people are feeling like the emotions that they're experiencing are really overwhelming them such that they're interfering with their ability to get their work done, to interact with their families, to enjoy their leisure time, really in any capacity, right? They're really interfering with those kind of activities of daily living, then I would suggest reaching out for professional help. And for anxiety and depression, I recommend cognitive behavioral therapy. Typically, CBT is short term, so like 12 to 20 sessions, and pretty action oriented. So your therapist will give you homework, right? Where you are noticing the thoughts that you're having, writing them down and coming up with alternative kind of interpretations of the situations that stress you out. Your therapist will prescribe you behavioral activities, right? To lean into things that make you anxious, or if you're feeling depressed, right? Often you don't feel like doing anything. And so often the prescription is do it anyway, to kind of get you more motivated, right? Knowing that the positive feelings will come over time. And so it can be really helpful to have a therapist that sort of is like accountability for you to do some of these things. And so CBT for anxiety disorders, often the success rates in terms of like full remission, like no longer meet criteria for an anxiety disorder, is like 75 to 80% of folks. Whereas like, sort of that others 20% like still see benefit. So I really recommend, and I think especially in this time of social distancing, one thing I've been really struck by is, the really quick shift to telehealth that many providers have made, myself included. And that it's been, for me, it's been great. I wasn't really sure what telehealth would be like, from the therapist side, but I've been able to reach patients all over Kentucky, right? That normally I wouldn't get to see since I'm based in Lexington. And so a lot of the barriers to seeking help are sort of addressed in that way. Plus, like if you feel weird or uncomfortable about sitting in a therapist's waiting room, it's not a thing right now. Do it from home.
Yeah, it totally erases that.
Yep.
Great. And someone from your position, have you noticed an uptick in, people needing and seeking out, mental health help, or just kind of, feeling more generally overwhelmed right now? Or has it been kind of the same as it was before we went into lockdown and then our world completely changed?
Yeah. So I think that we've seen kind of an uptick in people sort of seeking services for the first time, kind of recognizing this is a problem for them. But a lot of the people that I've worked with have had some longstanding difficulties, and sort of like now was sort of the time to seek treatment. And I think part of that is that there is this kind of onslaught of stressors. And also, like, now people aren't sort of like going to work or commuting or some of these other things that made barriers to seeking care. And so people are sort of like, well, now seems like as good of time as any to do this.
Sure. And all ages, or do you deal primarily with adults, or are you seeing a particular demographic that's been especially affected in your work?
So I deal primarily with adults, and no, so we see people sort of across the age span, from college students to sort of older adults.
Yeah. No one's immune. Yeah. You've been so knowledgeable and helpful and wonderful. Is there anything we haven't touched on that you think is particularly important to talk about or get out there? Or if not, no pressure. Like I said, you've said so many wonderful things already.
Yeah, no, I think that was mainly the stuff that I wanted to say, right? That like, you know, emotions, like these responses are natural and normal. And I think a lot of people sort of like have this mistaken kind of impression that it's weak to feel this way, that you shouldn't be feeling this way. And that just simply isn't true, right? We're evolutionarily hardwired to have emotional responses. And so when we beat ourselves up for having them, it prevents us from doing like the good work of, you know, questioning our thinking or using our emotions to prompt behaviors that might kind of help us in the long run, you know, have those emotions kind of quiet down. I recommend to people that are looking to find a therapist is call and have a first appointment. If it's not a good fit, you're not obliged to stay with the person. And often on the phone before the first appointment, I'll encourage people to kind of like interview the therapist a little bit and sort of say like, you know, do you give homework? Will we do worksheets? What's your philosophy in terms of like out of session practice? Are you going to teach me some skills? Right? Because if you're looking for kind of a short-term skill oriented treatment, you want to make sure your therapist is going to provide that, right? Many therapists sort of provide more sort of supportive care, which is also great in so many capacities, depending on what you're seeking services for. But if you're regularly having panic attacks, talking about how your week went isn't going to cut it. You need really actionable skills. So asking your therapist some of these questions before even the first session to make sure it's going to be a good fit.
Yeah, no, that's great advice. Well, wonderful. Shannon, thank you so much. I really appreciate it. I think this will really help a lot of people too. I know just among my friends and coworkers, honestly, we've all kind of had these same conversations of how much should I be paying attention, and I can't take it anymore, but I need to listen, you know, so it's good advice that I think a lot of people will be able to put to good use. So thank you so much.
My pleasure. How will I be able to watch?
This will air what is today?
I think, is it Wednesday?
Wednesday. I truly just blanked. This will likely air on Friday, and so it will air twice during the day, once in the morning and the evening, and it'll be on our website as well. So as soon as I have all the actual details about when it'll be on, I can shoot you a message to let you know.
Okay.
And then yeah, you'll be able to find it, especially on our website. It'll be up and available.
Okay.
So yeah.
Well, thank you so much for asking me, for finding us so randomly on Facebook with our Facebook page that is like not even finished.
I know. I just can't, like, I've done other mental health stories before, and I just don't ever want to talk to the same person 1,000 times, you know, because everyone's got different things to say. And actually, I think you're the best one I've ever spoken to. So I'm really glad it worked out.
I mean, I do consider myself kind of an expert in CBT. So
well, perfect. No, I think you said things that are going to help all kinds of people. So I'm glad this happened. It was serendipitous. So yeah. Good job for you too.
Have a good one.